This episode of the podcast is brought to you by New Bloom Labs.
I've said it before, lab testing is one of the biggest, most frustrating bottlenecks in our industry. Experienced cannabis producers know that it's simply unacceptable to wait 1 to 2 weeks or even longer for full panel analysis of your cannabis products. That's why you need to know the team at New Bloom Labs. The guys and gals at New Bloom Labs are the real deal. With locations in Tennessee and Texas and more to come soon, New Bloom Labs provides precise, accurate analysis and the best turnaround time in the industry. They always provide next business day turnaround on potency tests and 1 to 2 business day turnaround on most toxin screenings. They're ISO certified and DEA registered, so you know their science is first rate. Most cannabis producers are frustrated with their third-party labs, but fortunately, you don't have to be. Call New Bloom Labs at 844-TEST-CBD or visit their website at newbloomlabs.com. Superior science, rapid results, New Bloom Labs. Hello everyone, Kevin Carrillo here, and welcome to another episode of the Cannabinoid Connect podcast. My guest today is Ari Mackler, Chief Scientific Officer at Plus Products. Hey Ari, how are you?
Hi, how are you today?
I'm great. You've mentioned that you're based in California, is that right?
Yes, I'm here in Los Angeles, here in SoCal.
Nice. How is the weather out in LA today?
Weather, it's a little cool today, but I cannot complain. Better than my friends in the Northeast at the moment, that is for sure. There's no snow on the ground.
Right, exactly. And very few times is there no sun, right? Especially in winter. I mean, even if it's cold, is there still sun out?
Yeah, it's funny because it'll be chilly outside, but once you get in the sun, you warm up real quick here. And it's, I cannot complain. You know, people joke about having to pay the sunshine tax. I'm willing to pay that tax. It's definitely worthwhile.
There's something to it, man. Like this is the first day this week in Dallas where the sun's popped out. It's been like, flirting at below freezing, 30, 35 as a high. And the sun comes out today. And I'm just telling you, my whole mood is different. I'm happier. Like there's something about the sunshine. So I get what
Okay, let me stop you. It's going to be cold today here in Los Angeles. I think we may be like 64, 65 degrees. We're going to bounce back up to the low 70s tomorrow. So just having that said.
cold in the 60s, man. Oh, see, there you go, making me jealous again.
I'm just saying, you can come over. So.
Right. Well, once all this craziness is done, hopefully in 2021, I can get out there. I want to get out to San Diego. So I'll be doing that. But for those listening, I have Ari Mackler on. He's the Chief Scientific Officer at Plus Products, which is one of the leading cannabis gummy edibles in California and Nevada, with a CBD-only version available nationwide as well. So, Ari, before we jump into Plus Products and the amazing gummies that y'all are producing, let's first talk about you. So,
Sure.
Background, have you always been a connoisseur or an advocate of cannabis? Like, when did you make the transition? What's your background?
That's a good question. So the short answer is no, but I'll explain. So I'm a product of the 80s, man. I'm going to be real honest, right? I had Nancy Reagan sitting at my kitchen table yelling at me every morning and every night, and she's saying, Ari, you can't do this, right? Say no to drugs. I actually, sorry?
You're in the Gen X generation, right?
Yes, thank you for aging me. I am in the Gen X generation.
The forgotten generations.
Something like that.
Yeah, go ahead.
But I was in love with science. So I'm a scientist by training. I'm a basic scientist by training. Spent my time thinking about reproductive sciences, reproductive medicine, immunology, developmental science, things of that sort. I transitioned to some clinical science in academics, and then said, you know what, I love business too. And frankly, I didn't know what that meant as a kid who was still in school. And to me, business meant pharma. in science and medicine. That's all there was in my mind's eye at that point in time. So I joined, I guess, big pharma, so to speak, although we were kind of little pharma at the time. But again, focusing on reproductive sciences and medicine. So my goal was to help people get pregnant, not get pregnant. I was very much attuned to pregnancy and babies, and that was my shtick. And was having a lot of fun at the time, enjoying the science, enjoying working with different types of peoples and the business interface between science and the patient. And spent 10 years in pharma. And I moved from a small size company to a medium sized company to ultimately a large size company. I ended up at Merck after 10 years through just a series of acquisitions. So I was fortunate enough to stay with my same team and help to usher them across all these different acquisitions. But by the time I got to Merck, I said, okay, let me see what this is all about, big blue chip. But after a bit of time at Merck, I realized that it just wasn't suiting my needs intellectually or spiritually any longer. So I raised my hand to leave. And I bought myself a little bit of time to figure out what I was going to do with myself. My wife said, she says, okay, Ari, I want you to be happy. So figure out what you want to do with your life. And I honestly, I stumbled upon an opportunity with a let's call it a food company or a CPG food company, but we grew foods, spent a lot of, the company really focused its attention on fruit in particular, okay? And the reason why this is important to my little story here is that over the course of several years working in food, where I was still leading science and still running a clinical program and doing all the things that I wanted to do intellectually from a scientific perspective, I began to change my philosophy. I began to appreciate the differences and the nuances of non-traditional chemistry, drug kind of medicine. I began to really dig deep into the phytochemistry of foods and plants and to understand what they could do and perhaps what their limitations were, but also perhaps, what the opportunities could be, found within this chemistry. And was just in love with this kind of new space. However, the flip side of the opportunity is complexity. And I was appreciating how really difficult it is to fully understand the complexity of phytochemistry, right? The chemistry of plants and of foods and what have you. But was really making some very, at least I thought was very great inroads into that space. But I wanted to expand a little bit further.
So,
and that led me to cannabis.
let me pause you there.
Yeah.
So your background is really unique in that you've been on the science side, right? You're
Yeah. Yes.
scientist by trade. You've been in the pharmaceutical industry for 10 years, right? Working for a blue chip pharmaceutical company like Merck. And so I get the fatigue, right? And probably you get fatigued from that environment and working at such a big pharmaceutical company. But in addition to that, were you were looking for maybe, I guess, another alternative, right? And that is
100%.
to the plant-based alternatives.
Yeah. So I kept thinking to myself, oh, well, it's wonderful to be able to fix somebody, but can I perhaps protect somebody so they don't need the fixing? Right. That was a thought that kept kind of going through my head. What can we do as perhaps preventative medicine? What could we do in terms of food as medicine, a term that's often used that may not have perhaps the side effects that come with typical drugs that people may be fearful of, and perhaps justly so. There was a turning point in my head, in my brain. I was asked to sit on a Shark Tank panel for the Epilepsy Foundation. This is going back 6 or 8 years ago now, and that opportunity really, that kind of seeded the idea that cannabis had this awesome potential that I thought I was going to want to tap into. Because by sitting at that Shark Tank kind of panel and hearing all the different people speak and and we were voting on whether we were going to give certain types of prize monies to these new thinkers, which was exciting in and of itself. But I became really impressed by the sciences that were being spoken of and developed with regard to, for example, Epidiolex and mostly it was childhood epilepsy, but clearly that can expand outwards. And I thought to myself, wow, this is awesome. It took me several years to make the jump from food to cannabis, but that was really kind of a trigger, a magic moment, so to speak, in my brain and in the way in which I was thinking about my phytochemistry.
So yeah, so that specific example of how cannabinoids can specifically help a child with epilepsy and their stories and their testimonial is what really kind of got your attention.
Absolutely. And mind you, I'm not an epilepsy scientist, but it was something that really just, it hooked me. Just the potential hooked me. Yeah.
So walk us through what happened next. I mean, so you're on the food side, right?
Yeah.
And so when did you make that jump after kind of that turning point?
So it still took, like I said, it took several years. And a couple different friends over the course of history knocked on my door and said, "Hey, Ari, we're doing this, we're doing that. Are you interested?" And it always piqued my interest, but it was never the right time. I thought from an intellectual perspective, like I was always in the middle of a project, or I was always doing something that I didn't want to give up at that point in time. But the beginning of last year, I guess, the beginning of 2019, a friend knocked on my door and said, "Ari, um, I think you could really, flex some of your scientific muscles with us here at Plus. Would you consider um, coming and joining the organization?" You know, I hemmed and hawed a little bit. I thought about it for a couple days, and I thought to myself, look, if I don't take this opportunity now, there's always going to be something. I'm not going to, I'm not going to be able to jump into it whenever without having the right landing pad, right? And this was an interesting landing pad. And what I mean by that is it's an organization that was already thinking about science, although they didn't have a scientist on board. They had a lot of, or they didn't have a traditional scientist like myself on board. They had food scientists on board. They had technologists on board that was already laying the stage for a philosophy of the company that said, look, we want to be forward thinking. We want to do the right thing. We want to help people where they need their help. We want to meet the customer, the consumer, where appropriate. And I thought to myself, this feels right. And
So
so I made that jump last year.
So that forward thinking kind of science first approach is what appealed to you when the owners or the founders of Plus came and approached you.
Most definitely. Most definitely. You know, um, cannabis, look, I don't need to share with you or the audience, cannabis has a very interesting kind of persona to it, right? And that persona has ebbed and flowed and changed and shifted over time. And the idea of being able to join and help to mold in however a small way that I may be able to mold some of that perception or that persona, at least within the confines of my company, was an exciting opportunity to do something I think really great with a very powerful plant.
Yeah, it's a great position to be in right now. I mean, especially since we're at the forefront of just learning about all the various cannabinoids and the medicinal benefits associated with those molecules, right? So to be leading
Yeah.
charge from a chief scientific officer perspective at a company that's leading the way in edibles seems like a very exciting time, right? So tell me a little bit about the origin story of Plus Products. Like how
Yeah.
did start, what, you mentioned that science first approach, so what really kind of sparked that angle?
So that's a good question. Our two founders are not scientists per se, but they are scientists. How do I say this? We have two, I think, core founders. One was a data, we'll call him a data scientist, right? Um, Jake Highmark. And then my friend Crunchy, who I would say is a food scientist and really an artist in the kitchen. Um,
Name
and
Crunchy, or is it?
Yeah, we call him Crunchy. He's let's just he goes by Crunchy, and he fits the name, and he's a wonderful person. And the reason why I he and I became really good friends is because he's a wonderful organic chemist. but he approaches it from food and culinary perspectives. And he and I will sit around the table and just sit and talk about, oh, well, could we do this or could we do that, or what does this mean for A or B or C? And he approaches his cannabis from a very analytic perspective, but he has been part of the cannabis space for many years and decades. He comes with a lot of roots within the business. So what happened was that Jake and Crunchy got together, and Jake came, like I said, from a data perspective, from a business perspective, and when the two of them kind of became joined at the hip, they realized that they had an opportunity to do something kind of unique because of their analytic approach to making something fun, delicious, and perhaps to be able to birth a business that could sustain itself, which is clearly important in this very tumultuous industry.
Right.
Going back now several years ago, and this business was birthed in Jake's parents' garage. They built the clean room. They built all their equipment out in the parents' garage. And over the course of the next really just 3-4 years, founded a really a wonderful, thriving enterprise where we've got factories around the state. We've got, a robust sales force. We've got a robust, marketing group. The traditional small business, right?
Mm-hmm.
And perhaps what's most important is that we like to wrap our heads around, a yes, we have food scientists on staff, but we really let me reframe that. We look at the product and our offerings as a means by which to consume cannabis smartly, intelligently, perhaps for a therapeutic intervention that you may want for yourself, or perhaps simply for a recreational intervention that exercise that you want. But it needs to be delicious. It needs to taste good. It needs to feel good in the mouth. So that culinary kind of bent is really awesome.
Well, the culinary, and then I would imagine also the importance of dosing for those particular activities, right? I mean, if you wanted something for recreational and to chill out, I would imagine that gummy or that edible is more potent, as opposed to maybe something that's more therapeutic on, say, the CBD side, where you're looking for more anti-inflammatory properties. Right?
Yeah, that's a good call out. That's a good call out. So, we really spend a lot of time thinking through the formulations that we want to produce, and I'll be more specific. So, you began to talk about this, not just the specificity of the chemistry, which is important, but also the quantification, the confidence in the quantification. So we built out a system that has a very robust and rigorous testing and kind of component to it. Of course, we've got our internal testing apparatus, we've got our external testing apparatus. So we need to make sure that the customer, regardless of the company, regardless of anything in the industry, it's really critical that our customers know what they're getting, they feel comfortable with what they're getting, they get what they think they're getting at the end of the day. So with regard to your comment of the types of chemistries and how that may kind of bend towards the therapeutic side versus the recreational side, yeah, fully agreed, right? So, from a fun side, we have, 10 milligram products, but our real platform for the plus has been, I'll use the term microdose because we're very specific about small dosages so that you can actually achieve the ultimate goal that you're seeking. I'll explain more in a moment, but we're usually basing ourselves around a 5 milligram THC dose, perhaps a little bit more, perhaps a little bit less, depending on the specific product. But we do offer the 10. And then we have complementary, whether it's CBD or terpene, add additions to that kind of THC kind of foundation. If that makes sense.
For that full spectrum or full entourage effect, right? I mean,
yeah, that's definitely something that we've been thinking about a lot over the last period of time. What does the entourage effect mean? How do you achieve it? What's the best way to achieve it? How do we leverage that for that full effect. And what does that full effect mean? Honestly, we're still trying to figure that out as a science, as an industry. But there's something there. That is for sure. There's something there.
Yeah. Well, you know what I think is also interesting is like the future of consumption when it comes to cannabis, right? And so while it doesn't look like flower is going anywhere anytime soon, the trend of people smoking flower compared to other forms of consumption like vapes and edibles and tinctures, topicals, things like that are, we're kind of seeing that happen and take place. So what can consumers expect in the future when it comes to combining and pairing consumption methods together without actually smoking flower?
So if I understand you correctly, I'll answer in two ways.
Basically, it's like, what do you think? Are there any type of new innovative ways to consume? And will we expect to see more cannabis included in food and beverage in the future?
Short answer is absolutely yes, right? We clearly see that in the market. We are clearly thinking about it as, I'm clearly just thinking about it from a science perspective, as a businessman perspective. Is it something that I think is there an opportunity from a science perspective? What's the opportunity to be had, scientifically speaking? What is what is the onset? What is the safety? What is the full kind of breath effect, right? There's different ways to interpret the data that is being developed. And so the short answer is absolutely yes. We are most definitely looking at a full breadth of opportunities as to how we can meet the consumer where the consumer wants to be met. From the perspective of,
Let me pause you at that point. So
sure.
as you're doing that and you're thinking of new ways to innovate for the future, how far can you go with that planning and that forecasting and that experimenting without, that FDA consumer oversight where exactly what type of messaging you can say, what, these types of guidelines that are needed. How far can you go
So,
planning?
so you're asking a difficult question, one that I think through with our folks in house a lot, right? I think mostly that interface will most quickly run up against the FDA kind of regulatory infrastructure when you start to think about therapeutic side clearly versus the fun side. Having that said, it's very difficult to distinguish between those two oftentimes when you're non-medicinal. So you're still going to the same store, you're going to your dispensary, you're still buying the same product, perhaps yes, perhaps no, depending on the product and what you're seeking. We do, like I said at the top of our conversation, we have a line of products that are referred to, the name is CBD Relief. They're a little bit more biased towards CBD. They have THC, they're in the dispensary, and people do use them for various self-therapeutically driven purposes, right? On the other side, we have, a line of products, our core line, which, is geared mostly towards having fun, right? And we are not using the same type of messages, right? The messaging is distinct from those two lines, just as a point of example. So clearly the CBD relief messaging needs to be much more thoughtful, so not to run up amiss or against an FDA regulation. So the best way that I guess I can answer that is that it's a constant temperature read, right? And it's also the ability to be smart about what the data says, right? And so thankfully, over the course of time, I've spent a lot of time not pre-cannabis, right? Thinking about what does the science say? What can we say with the science as it currently exists? So I'll be point blank as an example, right? I've heard lots of people talk about the excitement that is wrapped around cannabis and cancer, right? This is an example, right? And the reason why I bring that up is because cancer is a heavy topic. Cancer is a big disease, right? But the science is evolving. Science will evolve at science's pace, right? And I want to make sure that we as an industry, we should be thinking responsibly as to what the science, how far the science has developed up to today, right? It may be a wonderful tool tomorrow, but for the sake of the argument, um, the data is very, very thin when it comes to like the clinical application of cannabis for cancer. But there's exciting preclinical data, in vitro data, animal data. I'm not dismissing that. I'm terribly excited by it. But we haven't been able to yet get over the hurdle, for example, of the clinical demands of data needs to make clear indications and clear messages from a business perspective. So that's a point of example. You need to know where the science is. You need to be very smart about what the science says and doesn't say, and be able to keep a gauge of the temperature in Washington.
Yeah, I get that. I mean, like when you say, where I get a little tripped up is when you say the science needs to catch up with the science. So I get what that means in theory, in that like we need more clinical trials, we need more peer review research studies that really indicate the medicinal benefits and the therapeutic benefits of these cannabinoids, right? But it's like what I'm thinking, and from what I've heard and talked with from other people, is that the science is there. It's that we're just kind of hamstringed with the federal regulation, right? I mean, until that's removed, then we'll be able to start doing those human test trials and really
Oh,
start
that I agree with. Yeah, yeah. So I'll interrupt you. So from that perspective, I agree with you. So there's a lot of great, very smart in vivo, in vitro, preclinical modeling science, and we are not able to jump into the clinical needs, that like the clinical research needs that we need in order to feel confident to say, oh, so we can't do that because of regulation at this moment in time, right? And so I have these conversations with my clinical colleagues at various universities all day long. So oftentimes we're reliant upon sciences that exist outside the U.S., right? So I'll give you as a counterpoint to something like to the cancer, as a counterpoint to that is stress and anxiety. People like to use cannabis for stress and anxiety. I get it. We have product that is geared towards those types of endpoints, and there is a decent data set for that. Didn't come from the American university system. Good science. Could it, can we do more? Yes. Well, always, science is an evolution, right? We're always doing more. But there is a decent amount, at least, of clinical science to rely upon when you want to seek out knowledge about how cannabis and its components can be used for various things. For example, stress or sleep, or anxiety, if we take it up a notch, versus even like seizures and Epidiolex.
Let me ask you a question here. This is just out of curiosity. So, like, say we waved a wand, and tomorrow, cannabis is legal, and the pharmaceutical companies and even the health industry is open to learning about this and to implementing it, right? Mm-hmm. So, how would you go about like introducing cannabis and even the discussion of our endocannabinoid systems into the healthcare system, or even like the education system? What would be some of the first steps that we would need to do? Because really, and the reason I'm asking is because it's really it's rarely even talked about, right, in the medical field.
I think it's being talked about a bit more. I've been trying to engage friends in these conversations. It's interesting, the conversations are different when I speak to my friends here in California versus when or in Colorado or West Coast versus my friends on the East Coast. Different conversations. I had a conversation last week with a very good friend of mine, a very prominent physician up in tri-state, right, up in New York. And so I was asking her what her thoughts were in terms of like, do you get people, asking you for, or talking to you about cannabis? And it was, well, Ari, I have these conversations, but it's quiet. It's like, oh, I do it. It's not a question of, should I use it for something? It's a question of, oh, I do it. I just want you to know that I'm doing it, doc. Versus here on the West Coast, it's like, I've heard great things about cannabis. Do you think I should be doing it, doc? Totally different conversations, different perspectives, right?
It's almost like, sorry to cut you off, but it's almost like when you go to the doctor's office and they ask you, do you smoke or drink? And most people are like, nope. And they don't,
Yep.
you know,
Exactly.
they about the 2 glasses of wine or the 3 beers that they're drinking at night, every night. Yeah.
That's exactly right. So I think the reason why I brought that up, that kind of distinction between East Coast, West Coast, and I'm making kind of short of it, um, but I think you understand what I'm driving towards. I think the idea of there's a demystification. I think there's we need to ratchet back perhaps the fear that comes along with it. I think when I say fear, it's sometimes it's the unknown fear, but it's also the fear of optics. It's the fear of, oh, I'm going to mess myself up fear. Like, I don't know what it's going to do, and things could go terribly awry fear. And there's a lot of good data that we can leverage today that will suggest that, you know what, cannabis isn't so bad for you. Oh, you thought having that glass of wine, and I'm not against having the glass of wine a day, maybe every other day. There's good data about the polyphenols, even the alcohol that comes from a little bit of alcohol consumption, mostly from a cardiovascular perspective versus a cancer perspective, but that's a different, right? We can talk about that on a different day. But there's reason to believe that having, your 5 milligrams of THC is maybe accomplishing the same goal with less detrimental effects than that glass of wine, just as a matter of fact.
Right.
So once we start to have that open conversation and we can peel back some of those fears, I think we will allow ourselves the opportunity to think about cannabis in new ways that we haven't collectively thought of before.
Yeah, no, you're so right. And again, disclaimer to the people, to everyone listening, right? These are anecdotal. Again, the peer, all the research studies and whatnot that we're yearning for and we're wanting are not all quite there yet. So a lot of this we're talking about is experiential, theoretical, and anecdotal. But I want to dive deeper on your point about cannabis and cancer, right? And I want to kind of really get down to the root of, like, is there one specific cannabinoid that kind of targets cancer cells? And the reason I ask is because I've heard that CBG, which is the mother cannabinoid, right? Without
Yes.
G, you wouldn't have THC and you wouldn't have CBD. That
Yep.
it has been known to reduce cancer cell growth. Have you heard that?
So now you're getting into some of these kind of nuanced data sets that really reside within the in vitro. So what does in vitro mean? In vitro means in dish or in glass, right? So we're talking about petri dishes. We're talking about basic science. And there is some in vivo work, in vivo meaning in life. So most often that's referred to, animal-based research. Most often, again, it's like we're talking mice, we're talking rats. There's some other animal models that have been used in that, but we don't really have much clinical data specifically. There is a little bit of clinical data, particularly with some brain cancers and some kind of terminal kind of brain cancer stuff, where there's been thoughts that you could have some regression of some tumor, of some surrogate markers for brain progression, some metastasis rather, and things of that sort. But it's really important, I think, for everyone to appreciate that we do not have a substantive enough data set in the clinical space to rely upon. And in fact, the data that people like to allude to, and I'm not dismissing it, it's exciting data again, it's really in vitro or in vivo, which means that these are kind of hypothesis-driven exercises, whether it's breast cancer, brain cancer, leukemia, lung cancer, et cetera, et cetera. We have not really developed out a clinical trial data set that is going to allow us to make any real claims or to be as excited as we potentially can and should be in the future. Right now, we're still resident in the basic sciences. Right. So is there a specific cannabinoid of note? I would answer that question is with there's a decent amount of delta 9 data. There's a decent amount of delta 9 data. Actually, my voice just triggered Siri, so I'm sorry about that.
Siri's listening to us. It must be the FDA. Who knows?
I'm telling you. So there's a growing literature of delta 9 stuff that people have been working on and there's some CBD stuff. There is other, the minor cannabinoids too, but since those minor cannabinoids are oftentimes difficult to obtain and to get because they're at such low concentrations, it has not lent itself very easily to many people really investigating them rigorously, even on the basic science side. So I would say the bias of science is still resonant within THC and CBD.
Got you.
But we do see some interesting things where we can see diminished cell growth. We can see shifts in latency. We see shifts in apoptosis, all the different mechanisms that people think through, scientifically speaking, to understand, what does cancer mean and how can you control cancer?
Right. Well, I mean, while you're saying that the clinical research isn't there, I mean, the data that we're seeing now, the preliminary data is exciting, and it's something that should be, kind of celebrated and looked into further, right? Which I know
100%. These are the reasons why. These are the reasons why we need to change a lot of the regulatory framework so that we can actually leverage this basic science to the point of potential therapeutics. If we're going to talk about medicinal cannabis for a second, right? Which is different than recreational use.
Of course. Yeah. And so, just to kind of wrap up the discussion of minor cannabinoids. So what is there any plans for Plus products to incorporate other minor cannabinoids into their edibles outside of like CBD? I've heard CBN is a good remedy for sleep, right? So
yeah, short answer is yes. I'm going to cut you off, my friend. So we literally just let's call it 2 months ago, just launched a sleep product which leverages CBN. So I use that as a point of example where CBN is there's a lot of interest around CBN in sleep. It is a derivative, a metabolite of THC, mildly psychoactive. There's an interesting amount of data. I want there to be more data on CBN, but there's enough data to suggest to me that it's a rational approach to kind of a sleep product for us to release it. Do I want to investigate the CBGs and the CB whatevers of the future? Right. The short answer is yes. From a perspective of an industry. So I kind of always have to separate my science brain from my business brain. From a science brain, I want to run experiments all day long, right? I want to be able to buy this chemistry or source this chemistry or whatever it may be and talk to my food scientists and say, okay, can you make this gummy with this for me? Because I want to taste it, I want to understand it, I want to feel it, yada, yada, yada. And they want to do the same. That's my scientist brain. But from my business brain, it's like, well, it's hard to source. It's hard to get certain chemistries, right? It's hard to get something, even if I found a wonderful, if I found a wonderful product, a wonderful chemical that I think people could benefit from, can I actually produce it in such a manner so that I can get it out into the commercial space for people to enjoy it or to benefit from it? That's difficult. I've been having lots of conversations with different companies who are want to talk about and develop technologies, whether it's using yeast or using other mechanisms to generate these small molecules outside of cannabis, outside the plant. It's intriguing. I'll be honest, I haven't played with any of those yeast-derived chemicals, but it begs some interesting questions, I'll tell you, right? Should we be thinking about this in a way outside of the plant? Like, the plant is the source material. We understand what it is. We take as genetics, but we can perhaps manipulate other biomachinery, for lack of a better term, in order to get a sufficient amount of chemical, so it's viable as something, as an inclusion into a gummy. Right? It's something we're thinking through.
And you're making that point because, as you said earlier, like the effort in which to extract some of these minor cannabinoids, it's just that they're so low level within the plant that it's hard to do so.
It's tough.
Yeah. So you're saying we're going to need to re-engineer it at some point and create equipment that tackles a specific cannabinoid so that that solution is customized for that particular extraction.
It is a logical option. And since it's a logical option, I think we need to explore it. It may, I'm also sensitive to the fact that people, and I'm not knocking it. I may step and sound, arm shoulder to shoulder with them and say, okay, if we're going to remove it from the plant, is it really the plant? Is it, let me restate it. I get farm to fork in the food sense. I get, farm to pharmacy. I get farm to,
Far-
cannabis, right? I get it. Um, so, and we're missing a lot of opportunity when we move away from that. And I'll be specific. I'll be very specific. Um, so I told you back in the top of our conversation now that I was trained as a basic traditional scientist, right? So one chemical or one molecule, one receptor, one response, that kind of like very linear thought, which is powerful. Don't misunderstand me. But when I moved into food and now I'm sitting in cannabis, I am very appreciative of the milieu, right? Yes, we can call this the entourage effect as well, within cannabis. But when we start to pull one molecule out of what is this kind of entire soup of chemicals, the milieu, the cornucopia, right? Mother Nature gave us something in a specific combination. Oftentimes, when we pull out that one molecule, we're cutting it off at its knees, right? We're limiting its potential and the opportunity that we could leverage from it. And I'm hesitant to do that. Sometimes it's necessary, sometimes we must, but we need to be thoughtful as to how we go about doing it and what the implications of those decisions are. So let's be real specific. If we take CDX, whatever it is, right, and we pull it out of cannabis, it may very well have value, but it may have a value that is limited to what it could have been if it was within the entire consumption of that cannabis soup. And so I respect the soup, and I don't want to lose the soup just yet.
I respect the soup too, and I love the way that you're putting this, because like the average person like me can just understand and really take in what you're saying. And what sucks about what you're saying is how the federal government has kind of demonized one molecule within the whole entire plant, and it's kind of forced us to make that move of separating and isolating cannabinoids to remove, to get rid of the THC, or to
That's
separate
right.
from the THC.
That's right.
You know?
It's forced us, and again, there's lots of bad reasons why the history of cannabis is what the history of cannabis is, right? That's a conversation for a different day. But from the perspective of traditional, let's call it Western medicine versus Eastern medicine, um, pharma science, um, I kind of get that. I get if you can't identify it, then how can you prove it? How can you show it? How can you administer it? There's some logic to that thought process, but when you understand it and then you take a step back and you realize, oh, wait a second, what else have I done? You understand the limitations of that, and I clearly, I feel, I see that in my own work, in not cannabis work, maybe cannabis work too, but back in the day, like I would run experiments with specific extracts or with specific whole food products or what have you, and benefit can be had from both, but not the same benefits. They're different. And the only way that I can really explain it is the removal of one chemical from the chemistry, right? You lose, if you have your potatoes and it's just a potato, well, it's just a potato. But if it's a potato in a stew that's mixed with carrots and celery and whatnot, it's much more delicious.
Yeah, and and even I step back one more little kind of, I'm literally like taking a step back when if this conversation, and my mind blows, because all we're talking about right now with this soup is the minor cannabinoids. Then you throw in the secondary
Oh,
molecules, right? The
that's exactly right. Yeah.
terpenes, the flavonoids. It's like my mind.
Oh, I look at all of this together. That's correct. You're spot on, my friend. Spot on.
Yeah, so I mean, it just takes so it just kind of shows how complex the plant is, and even further how complex the trichomes are, the cannabinoids, the minor cannabinoids, the secondary molecules, and how you mentioned when all put together in this pot of stew, there's multiple, if not several benefits, right? Hundreds. But if you start to isolate and you just be prescriptive as to what benefit does for each, you're not getting that full optimized effect.
Yeah. So as a point of fact, as a point of example, rather, right? So we've launched a couple specific new products over the last several months, um, and particularly some that are really echoing strains. And the reason why I bring up strains in particular is because we were very thoughtful about how to create specificity to that strain in the product. And the way in which we approached specificity was through the terpene milieu, right? The inclusions of terpene that was not just echoing, but specific um, for a particular strain. And when you think about the milieu of terpene, right, you may have like 3 or 4 critical terpenes that are you see across all different strains in cannabis, right? You have your myrcenes and your beta caryophyllines, and you got the key players, right? But it's all about oftentimes the subtle differences in concentration, or maybe you throw in one little unique one into this. Again, let's call it a soup for lack of a better term of terpenes. But as you play with just relative relative amounts of these terpenes, you get very different effects oftentimes. So you may have the same players with an indica, which is often, the same players as that what you would have with your sativa, but you get a different, clearly you can feel different effects. You can see the different effects, but oftentimes the differences in the actual chemical players, that the team members on that baseball team, not so different, right? Not so different.
Right. Exactly. Yeah. It's a big puzzle is kind of how I see it,
Yeah.
and when they talk about this notion of the future of medicine, it's going to get to that point where, and this is going to be years down the road, but once we have a really good handle on the science behind these molecules and what exactly they do from a medicinal or therapeutic standpoint, we're going to be in a position where we can dial it in, and
Yeah.
really start to target and hyper target ailments, and utilize cannabinoids to address those elements. And that's
Hopefully, but remember though, you used a good word. It's a big puzzle. Puzzles are scary, right? How oftentimes you walk up to that giant, and I'm not a jigsaw person, right? I don't see all these. I see a jigsaw puzzle and I walk the other direction.
me too.
That's what we have here, right? We have this jigsaw puzzle of chemicals, and that will scare off people because it's so complicated. But we need to put the elbow grease into it and really understand this if we're gonna
Yeah, we need to put
understand this.
the elbow grease, and we need to step back and see, okay, is what we're currently doing, is that working? Is what we're
Yes.
doing?
Yeah.
And if not, which it doesn't seem to be, right? It's just more of kind of a management, but not really kind of addressing certain problems. Why not look at other methods and other alternatives? It just makes sense. So at
Absolutely.
least that's my opinion.
Yeah.
Hey, Ari, tell me a little bit about the future state of the edible category and what trends you expect in 2021, and then we can wrap things up here.
Of course. So I think edibles it's clearly a significant portion of the industry, right? Um, flower is still a giant component of it. Vaping is a component of it. Edibles is a component of it. And from an edibles perspective, gummies are the most significant component of the edible space. But that doesn't mean that it's always going to be that way. Um, we think, I think it's going to continue to be a wonderful form factor for consuming cannabis. It's functional. We can work with it. It's malleable. We can deal with it from an operations perspective, and it's fun to eat, right? It's fun to eat. But we are exploring other, right, delicious kind of form factors that people will be able to enjoy their cannabis through. Um, so I think you should continue to expect people, including us, to push the envelope of the edible space in those offerings, in terms of flavor, in terms of texture, in terms of mouthfeel. All of these are wonderful ways for us to work through the experience rather of consumption, right? So that's a great thing. Plus, also, we're clearly thinking about outside the box of edibles too. But what does it mean? What are unique opportunities? People are interested in, oftentimes, just as a point of example, an area that we're not really spending much time on, frankly, but like in the CBD space, there's a lot of anecdote on skin. That's very different than consumption, right? Through the oral. Um, the science on skin is not super tight, right? It's not really, we don't have good bioavailability data there. It's difficult to unpack. We're trying to understand that. So I just use that as an example of something on the other side of the spectrum. But we as a company really keep eyes wide open. We want to understand what exists. How can we help push what exists to its next limit, so that we can help the consumer enjoy the products that they seek to purchase.
Well, I give you all a lot of respect in that, like, you have a bird's eye view of what's trending. Like you talked about topicals and things like that. But, you don't want to make that move yet until you fully understand the science and,
Exactly.
figured out yet, right? I mean, people are still working toward that. So it would
Yeah,
make sense for y'all to jump in head first when, you're not there, because again, it speaks to your brand, which is taking a science-based approach.
absolutely. No, yeah, no. Thank you for calling that out. It's important to us. We want to understand all the options, and we get to look through, think through, and develop all of these types of options in house, and we get to say, okay, can we stand behind it? Do we feel good about it? Do we think that people are actually achieving what they want to achieve? And I'm not knocking skin topicals. Don't misunderstand me. There's wonderful anecdote. I know many people say, "All right, this is fantastic for this ache or whatever on my knee or this, CBD."
I'm
My only point is,
I'm one of the guys. I mean, I love Papa and Barkley's rub. I mean,
yeah,
I put it on every night, and I feel.
absolutely.
Uh,
So I'm just saying, from my perspective, I want to understand the science. From our company perspective, we want to understand the value add to the patient, to the consumer, so they get what they want, and can we live up to expectations?
Hey, that's commendable. I love that mindset and that approach, and really look forward to seeing how y'all push the envelope when it comes to edibles in 2021. Uh,
Yeah, we're looking forward to getting out there with a lot of new product.
Absolutely, yeah. So, Ari, where can people find y'all online? Like a website, social media?
Yes, plus products THC, plus products CBD, plus products.com will all lead you to where you need to go. And at your local dispensary, you will find product.
Awesome. Well, I'm definitely going to be shopping at the Plus Product CBD site, given that I'm in Texas. But yeah, man, I look forward to trying those edibles. They sound great.
Yeah, they're delicious. They really, they're fun. They wonderful flavors, great texture. I'm sure you'll enjoy.
Awesome. Well, Ari, hey, I really appreciate you being on. I want to have you back on in the future, as
Absolutely. We're looking forward to it.
the edible market evolves. Yeah. So thanks again.
Absolutely.
And thank you all for listening.
Be
Bye.
well. Talk soon.